It's a never-ending journey, a journey of love and survival for a mother fighting for her son's health.
Tyler means everything to me. Being my only kid, he's my future.
I think she's the best person to have in my life. I really don't want to lose her.
Beth Booth and her 17-year-old son Tyler have overcome obstacles to treat his mental illness.
Hi.
Today, Tyler gets relief through counseling from Adult and Child Health, a mental health provider. But Beth recalls times when life was a nightmare for her son.
Temper tantrums, easily frustrated. It seemed like his mind knew more than his body could do. He would want to do things and couldn't do them. He would get angry, and I was just so frustrated because everything I did didn't change anything. It didn't get any better.
In elementary school, around 3rd grade, the problem grew worse for Tyler.
They just couldn't contain him in the classroom anymore. He had been throwing things, throwing pencils, saying threatening statements to some of the other kids and some of the teachers. They finally said, if we go ahead and give him an expulsion, it'll allow you to get into a program that Johnson County had, which was Johnson County Special Services, that would allow him to attend school for children that are having trouble at school.
But it was a half-day school. Tyler would need before and after school care.
We tried everywhere, and nowhere could keep him for more than a couple of weeks because of his behavioral issues and his mental problems. They just couldn't.
Beth, married today, but a single mom for years, was desperate, finding little help for a child with mental health issues and running out of options.
And I actually ended up losing a job that I'd had for 6 years because there was no one to be home with him.
Eventually, doctors diagnosed Tyler with Asperger's, a developmental disorder on the autism spectrum. But that diagnosis changed with age.
He started having some hallucinations. He started hearing voices. He started becoming more and more angry, more fits at school, more throwing and self-harm.
It was frightening and really difficult to deal with.
He was just a child with a mental disorder far beyond his control. Doctors changed his diagnosis to child-onset schizophrenia. Beth learned the chronic brain disorder was genetic. Tyler's father was diagnosed later in life.
I was scared. I didn't know much about schizophrenia. I know there's a big stigma about it.
But with answers, they could seek solutions. Tyler's treatment took root with therapy, medication, and a full wraparound program from Adult and Child Health that included a behavioral coach.
That just saved my life. It just saved my life to have so much support, so many people around me.
We're doing great. Double thumbs up.
And it saved Tyler's life.
I think I need to start working on the ability to be able to go to college.
He's done so well that he no longer needs to be in a full wraparound program. So he just has therapy now, and he's able to attend high school.
But I'm gonna go.
And Tyler is on a roll today, more active, more engaged, more confident. But he carries underlying pain from the past, remembering how his mental health issues impacted others before his treatment.
It just makes me really sad to think that that was me back then. Since I can't go back and change that, it just destroys my heart.
It's heartbreaking. It's heartbreaking. It is. Because you love him so much and you know the kind of kid he really is. You know how funny and smart and caring that he is.
But Beth can't control the way others perceive him, the stereotypes Tyler faces because of schizophrenia.
I get bullied by other students because I have it, and that's just something that I don't want other people to have to go through. I don't want them to be bullied because they have a mental issue like schizophrenia. Like, I'm always laughed at. I'm just different. That's all. I'm not an alien. I'm not anything other than human.
He's a kid. He's a teenager. He wants to do all the things other teenagers wants to do. You know, he wants to have a girlfriend, and he wants to play video games, and he wants to eat pizza. That's who he is. He's not schizophrenia. He's Tyler. There's a strike for mom.
There you go.
Strike for mom.
And he is someone's child. Beth urges people to have compassion for adults and children with mental illness.
There's so much of a gap in a lot of the care for the kids. We can fill that gap with each other. If we support each other and listen to each other and don't judge each other, we can help each other get through this.
And you can support more mental health services, something Tyler and others so desperately need to treat disorders that are not their fault.
If those services weren't there, I don't know where we would be. I don't know where we would be. My biggest hope is that Tyler will have the life that he wants.